Good morning, students. Today we have a discussion about, I have started with general pharmacology. This is actually, I have been in Haramaya University, in which was teaching the MD students pharmacology, and I felt that this will be useful for medical and paramedical students who are undergoing various syllabuses with pharmacology, a general pharmacology for various examination point of view. It will be having a basic pharmacology can be revised. So anyhow, today it's not possible with one lecture. I just want to make it some 3-4 lectures. In the first beginning, we will start today first the initial one. This is actually pharmacology form 401, which is given a syllabus number in by means of the curriculum which is framed by Haramaya University, Ethiopia, East Africa, where they have given the preclinical year 2. We started with this pharmacology subject, and so I hope this will be useful for other paramedical and medical students for a basic revising, and even for the people who go for an interview or for any examination point of view. It's just I am giving the basic idea. So here, recommended books for you a reference. You can see Basic and Clinical Pharmacology by Katzen, Pharmacology by Rand, and everybody we used to say Goodman Gilman, Hardman J.G., Ligbird, Yelly edited, and Goodman Gilman, The Pharmacological Basis of Therapeutics, 9th edition, and also now the new edition is also available. This is in 1996 edition, and we can have the reference of these books, and there are many pharmacology books which you are refer also can be, you can give your references. What is pharmacology? This we are going with the basic actually. Pharmacology is a science of drug action dealing with study of interaction of chemical agents with living organisms. Chemical agents with living organisms. Sorry. With living organism. And pharmacy. What do you mean by pharmacy? The art and science of compounding and dispensing and increasingly drug information, manufacturing, this all comes under pharmacy, and even we have a lot of branches in which up to research and development of a new drug. Pharmacognosy, the study of drugs from natural sources, and which includes even isolation, characterization, and identifying the specific pharmacological actions towards the natural sources. And drug, what do you mean by drug? The definition: any agent that by virtue of its chemical properties alters the structure or function of biological systems introduced or applied to a living organism to prevent, cure, or to even diagnose the disease. They are called as drugs. So you have to clear with the definition for a drug. What do you mean by xenobiotic? A compound foreign to the body, not produced within the body, physiologically, endocrinologically, or pharmacologically active. What do you mean by pharmacokinetics? Study of the effect of living system of drugs. Is a study of what the body does to the drug. Pharmacodynamics, a study of effect of drug on living systems, is a study of what drug does to the body. Clinical pharmacology and therapeutics means study of the actions of drugs on normal humans or patients' application of the principle of pharmacology to patients for what? To prevent, cure and to diagnose. So you should have different definitions is needed for every basic study for pharmacology and also for any examination point of view. Toxicology. We will immediately remember about the scientist Paracelsus. Study of adverse effect of chemicals and drugs on living system. What do you mean by bioavailability? Systemic availability. Systemic availability means we are talking about the system. Our body is systemic. In the bloodstream, inside the body, the systemic availability, the amount, fractions of proportion of the given dose of drug that eventually reaches the system circulation in unchanged form. In unchanged form. That is the important thing. That is the action. After unchanged form, we are talking about unchanged means it is going to metabolic pathway and excretion stage. So this is unchanged form in the circulatory system or inside the system. What do you mean by bioequivalence? Comparing with another drugs. That is, if two pharmaceutical preparations or formulation have equal systemic bioavailability, then they are considered to be bioequivalent. So this bioequivalent study, bioavailability study in detail you will be studying in various subjects, because you have to determine a drug formulation. A pharmacy student, if they want to manufacture or if you want to prepare a formulation, it is necessary or change the formulation from one form to another form. It needed to have the bioequivalent study, and bioavailability studies are to be carried out. And clinical indication. What do you mean by clinical indication? Something that serves to be characterized by observable and diagnosable symptoms. What do you mean by side effects? A result that has not been anticipated from a certain specific course of treatment. Again I am repeating, just listen. A result that has not been anticipated from a certain specific course of treatment. Side effects are sometimes beneficial, and the other side sometimes or other times it is harmful. What do you mean by adverse drug reaction? This is dangerous. Unfavorable, harmful or undesirable drug effect away from the desired effect from the particular drug. That means which you have not at all desired, undesirable effect, unexpected, we don't want, we are not expecting this effect. Adverse effects should be always avoided, and it has to be monitored for any type of drug treatments or drug given to any patient. Drug allergy. What do you mean by drug allergy? Exaggerated or pathological immunological reaction, as by sneezing, difficult breathing, itching or skin rashes, etc. to drugs. We can say many types of things. You might have studied most of them, but the initial stage, if you want to come for pharmacology, this is needed. That's why I'm not going for triple response or redness of the skin or leukotrienes or prostaglandin secretion. All these things we will be discussing in slowly in terms of going in the subject. Toxicity, degree of poisonousness of drug in their elevated doses, increased doses, double dose or overdose. These all are toxicities. And blood dyscrasias. What do you mean by blood dyscrasias? Blood disorder, an unusual condition of the blood cell. Teratogenicity, induction of source, birth defect causes, there is an adverse effect, induction of severe birth defects caused in patient, they are called teratogenicity. Mutagenicity, that is genetic toxicity. Any agent capable of altering the genetic constitution of a cell by changing the structure of the hereditary material, that is DNA, deoxyribonucleic acid. Carcinogenicity, a substance or an agent or a drug on use causing cancer. Complication, a secondary disease or condition developing in the drug treatment of a primary disease or condition, or you can say an unforeseen condition occurring during the course of disease, complication. Contraindication, sometimes or something, not is something that makes a particular treatment, or you can say as a symptoms or a condition while doing a particular treatment, or produce indivisible or inadvisable state of something to be, which takes particular medication because likely to be adverse reaction, or you can say undesired effect which you are unexpected. Contraindication, a symptom, an indication which can be absorbed. Contraindications, if you there immediately you just inform the physician or the nearby pharmacovigilance sector, the state of unadvisable or undesirable, they are called as contraindication. It can be similar as an adverse reactions which has been symptoms which has been observed. The indication, for example, if there is an itching or a swelling or something which is having blurred skin or something, eyes, blurred eyes, or which vision, a double vision or something which you have an adverse reactions which we are not observed, that symptoms are called as contraindications. Have to be even mentioned in certain, if suppose if they are using some other drugs or something which is contraindications can occur, immediately they will give a precaution. You have to tell with your physician or to the pharmacovigilance sector or to a particular responsible authority in the market, have to be informed. Mechanism of action, MOA, the pharmacology, the term mechanism of action refers to the specific biochemical interaction through which a drug substance produces its pharmacological effect. A mechanism of action usually includes mention of a specific molecular target to which the drug binds, such as enzyme or receptor. For example, the mechanism of action of an aspirin involves irreversible inhibition of enzyme cyclooxygenase, which suppresses the production of prostaglandin and thromboxanes, thereby reducing pain and inflammation. Therapeutic agents. What all therapeutic agent definition? First, pharmaceuticals means what? Preparation of drugs. Various drugs like tablet, capsule, syrup, transdermal, polymers, and we have many nanoparticles and sustained release drugs, and also we have many new phytosomes, and novel drug delivery systems are nowadays more common. So we can see nutraceuticals supplements, functional design, foods actually. We will study about that. You have a big chapter itself. I have explained in my lecture. You can just listen to that. Nutraceuticals also. Biologicals, vaccines, bacterians, toxoids, antiserums and antitoxins. These all are some of the examples which I am giving for you, therapeutic agents. Drug nomenclature. What do you mean by drug nomenclature? Prescribed drugs. Consider unsafe for use without medical supervision. Sometimes it is needed. WH, that is Schedule H. Schedule M. 2. B. Dispensed by order of the licensed physician, veterinarian, that is veterinary doctors, dentist, and etc., which they have the permission to prescribe. Non-prescription drugs sold in over-the-counter, OTC drugs, they used to say over-the-counter, judged safe for use without medical supervision, which can be given by the pharmacist over the counter without prescription. Could be purchased without prescription. FDA empowered to make the decision on the OTC versus prescribed drugs. FDA is responsible to give which is OTC and which is needed for the prescription drugs from a physician. Most drugs have 3 names. Chemical name, this is an example I have taken, acetyl salicylic acid. We know that aspirin, the chemical name is acetyl salicylic acid. Generic or non-proprietary name is aspirin. Trade, for example, a company can give a name for an aspirin when they produce. This is ascriptin and ecotryptin. These all are given by, I think, Bereswelcome. And the company, they have given their own names for their trade name. Patent versus generic drugs. What do you mean by patent drugs? Something which is they are giving a license not to they have the name, they are the only person who have identified that particular drug. Proprietary drugs, trade name, drugs protected by the law, exclusively the marketing rights, original drug which have been produced or manufactured or been researched and they have developed a particular drug themselves, then they will get the patent. It's a pioneer product. If anybody wants to use their name, they have to pay them certain amounts which they have fixed. Generic drugs never be patent because already it is generic. On patent expiry, if suppose patent expiry, any company can market any name or own trade name. Pharmaceutical preparations, that all you can see drug forms. Solid, liquid, paste, that means we are telling about solid dosage form, liquid dosage form, semi-solid dosage forms. There are many which we will have a small discussion. Drug product, active ingredients, it will have vehicles, excipients, preservatives, coloring agent, extra, etc. will be added to make a formula. If it is a tablet or a capsule or a syrup, it needs not only the active principles, they need a lot of other excipients to make the formula into a feasible formulation. Solid dosage forms, powder dosage forms are available. Tablet is there, compressed tablets, even entry-coated tablets, sustained release tablets. There are various matrix tablets which is available now in the market, bigger in every different sector. And capsules also available in soft gelatin, hard gelatin capsule, pills which is having mold. They used to prepare by means of mold that is ovoid shape or spherical shape, which is mass, which is covered with the syrup by means of using a mold or it is also available in the market. It was an old method of preparation of solid unit dosage form. Liquid dosage forms, oral, we can see mixtures are available. And in pharmaceutics, when they are studying pharmacy students, they may have studied various different sectors, solution, emulsion, suspension, all these things. We are not going to discuss in this subject, but it is there in detail. They will be studying about various sectors in different formulation, the liquid, solid and this powder form and semi-solid form. This is only I am telling mixture, aqueous solution, suspension, emulsion, syrups, 85% of sucrose solution with a flavor and coloring agent, elixir, sweet flavor, hydroalcoholic solution. Tinctures are also available. Hydroalcoholic solution, tincture of iodine is an example. Dosage forms, you can see capsule, tablet, syrup, suspension, and it's just a picture I want to show to just to make a the initial pharmacy students or initial medical students or initial any paramedical student, they will be knowing in the home, but still they should know syrups, tablets, blister packing, and normal aluminium foil packing is also available. Hot gelatin capsule, soft gelatin capsules, and also you can see spacules. That means we can see granules which is coated and also filled in the capsules is available in hot gelatin capsule. Like example, ferrosulfate capsules and omeprazole capsules. If you want to see, you can just observe which is available in your home itself. And there are dosage forms. And when you come to this is also dosage forms like ampules, vials, which are very commonly, which we might see in infusions, which are nowadays available in bottles and also nowadays plastics, and which can be very hard plastics, and sterilization is very easy, and also carrying transportation. That's why they used to even infusions are also available, small infusions, large infusions, which we can see very clearly. And we can see this is a part which I want to show. This is a picture to show you how the system is working and how the route of administration. Before going to the route of administration definitions, we should know what is route of administration. Route of administration means we are giving how to inject the drugs inside our body, how to insert there is very routes, oral routes, parenteral routes, and also we can use in the skin, which can be used nowadays very common. So you can see ingestion can be done by GIT, oral route. And you can see that is the gastrointestinal tract in the picture you can see, and an arrow dotted is going to feces. That is why directly into the intestinal and absorption takes place, which may enter into the systemic cycle. But before that, it may enter into the bile and first pass effect to the liver, and then some will be excreted. And you can see that is the lungs also. There is inhalation can be done. There are many inhalation type of drugs which can be taken, aerosols, inhalations, which can be used for our asthmatic patients, and various drugs can be treated. Exhaled, there can be sometimes excretion can be takes place in the same way, and it enters into the blood limb, and then extracellular fluid also it can be entered, and organs, site of action, bones and soft tissues. And from the blood limb, you can see it can enter into the skin, and it can be excreted through sweat and oil, or it can enter into the kidney and urine, and it can be excreted even. So the route of administration can be given by intravenous, intraperitoneal, subcutaneous, intramuscular, and even in the skin intradermal is also possible by means of using the inserting or incorporating or making the way for a drug to enter into our body. So this picture just to give you a basic idea about that drug administration and how the drugs can be entered into the bloodstream and what is meant by excretion, and in between we did not show about the metabolic pathways. And here the entry movements of the drug molecules to the body, the site of action, metabolism and excretion. You can see this is also another picture just to give you an idea. It's also taken from different sector to make the student to be basic idea. That is, drug administration can be given by parenteral, oral, or any means like transdermal, novel drug delivery systems, or by means of semi-solid creams which can be applied in the skin or in the mucous membrane, aerosols directly. So these all are things. There is drug absorption first, the site of absorption, and get into the plasma, bound drugs and free drug. Then the free drug will enter into the storage in this tissue, site of action, and they will undergo for metabolism, entering into the liver, lungs, GI tract. And excretion can be taken by kidney, sweat, by kidney by urine, and expired by air, sweat by in the skin, and feces through the rectum by large intestine, GIT tract. So this is what, just to have an idea about a route of administration of drug. We can see internal route, via gastrointestinal tract, oral, sublingual, rectal, vaginal pessaries. And parenteral administration by means of injection. Topical applications by semi-solid applications can also be done, and even liquid. This is an example to show you pessaries, vaginal pessaries, how they will keep. There are rings, there are tablets, there are sponges, and even very contraceptives, and also vaginal condoms are also there. So these all are inserts which is present, and they are, and when you see a solid substance, then you say vaginal pessary. And then rectal suppositories, different shapes and different length and width is also available as shown in the picture. 1, 2, 3, 4 different sizes, centimeter according to that, and it can be inserted to the cavity. And how to insert the suppository? Remove the wrap which is given in the suppository in rectum, and moist little, because it has smooth suppository, with water and water-based lubricant gel. And then you can just lie down as shown in the picture, lift up your right leg, and you can say right knee, and hold, and to the chest, towards the chest, gently push the suppository into your rectum, into the deep enough, and that it should not come out. And that is the way you have kept the picture which shows the suppository, how it has been inserted into the rectum. And this is the way how to insert. That is, sometimes we have to place it, that is self-inserting is possible. Oral administration, we are talking about oral administration now. Advantage: easy, self-use, safe, convenient, cheap, and no need sterilization when you go for oral dosage forms. So what is the disadvantage? Low effect, no complete absorption, low bioavailability when you take a tablet, and destruction by GIT, because there will be some absorbed, some will be excreted, and it disturbed by means of our pH in the GIT. And first pass effect, it will enter into the liver, and there will be some will be metabolized, and GI irritation may also take place in some of the drug. Food and drug interaction may take place, drug-drug interaction may take place, not suitable for vomiting patient, unconscious patient, and emergency. We cannot give oral route administration. And when we come to oral administration, when you want to detail, the most common route of systemic administration, the most of the absorption of the drug occurs in the small intestine, because it is specialized for absorption. Large surface area due to villi and microvilli present in the small intestine. If a drug is to be absorbed effectively, it has to be in the solution form. Hence, water soluble. Most of the drugs are water soluble, but must also be able to pass through cell membrane, lipid soluble as well. If it want to cross the blood-brain barrier, if it want to act on the central nervous system, it has to pass through lipid soluble too. Drugs which was given in solid form, the tablet, they had a rate limit step, and that's why we used to say disintegration, dissolution of the drugs are very important. Note that point, that is, drugs of tablet form, they need disintegration, dissolution before absorption, and then distribution, then comes action, that is, then comes the metabolism and comes excretion. Example, digoxin is poor soluble. The particle size used in the manufacture to be of a tablet needs to be very slightly controlled, because it has very small therapeutic window. So that is also very important. Suppose some drugs will be having what is meant by therapeutic window. A small therapeutic window, that means the distance or the amount needed for it to be toxic is very narrow. For example, if it is 20 milligram is an action, and if it is becoming 50 milligram, automatically it becomes toxic. Suppose some of the drugs will be there, if it is 20 milligram of action, even 1000 milligram also, it may not be a toxic substance. So that is, therapeutic window is wider. But when the therapeutic window is narrow, we should be very careful in formulating them. And also we should be very particular. The dosage should not be increased by any means when you are giving a formulation. So a therapeutic window is when the dose required to have a therapeutic effect is very closer to the dose required to have a toxic effect. That's what I told. Suppose a compound which is having 20 milligram is a therapeutic effect dose and its toxicity is within 10, 50, 30 milligram if it is toxic dose, then it is very, 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 very dangerous for us and it has to be monitored. But there is no other way, like digoxin, we are depending on the treatment of cardiovascular system patients. So that is the therapeutic window. It is also a very important question, which is what do you mean by therapeutic window? What do you mean? What is the benefits of having therapeutic window narrow, or what is the disadvantage of being narrow or wider therapeutic windows? And if the tablet is made up of small particle size, it will dissolve easily. Particle size plays a major role because surface area increases and it easily dissolves if it is smaller particles. Therefore, get a high dose. If the particle size is large, dissolution will be less and so result in smaller dose, Again repeating, read it. It is about physical pharmacy and general idea. Once you read only you can understand. If a tablet is made up of small particles, smaller the size, surface area is more and which dissolve easily and therefore gets a high doses. If the particle size is large, dissolution will be less and so result in a smaller dose. This is just a theory and also it is practically applicable. A disadvantage of oral administration is that all blood from the gut must pass via the portal vein through the liver first, that is first pass effect. The liver metabolizes many drugs and so they are inactivated before entering into the systemic circulation. So there is loss of drug due to first pass effect which enter into the liver. This is called first pass effect. That's why we used to say when you are taking drugs to the oral, loss of drug is more through first pass effect. So the dose which is given by the oral route will be more than the dose which is given by means of parenteral route. So this is a simple example for the student should remember. When you are giving paracetamol by the oral route, its dose is minimum 500 to 1000 milligram. But when you are giving the dose which is given in parenteral route, 5 times lesser than the oral route, will give 100 milligram injection is more than sufficient, which can enter into the bloodstream directly with 100% bioavailability. So this is the system which we have to know about. What is the bioavailability of the drug formulation and what do you mean by bioequivalence of the formulation? In a different formulation, the same drug can be easily identified and formulation can be prepared by the pharmacist. Very clearly I have told, just go through and read and it will be helpful for you to know about the basic theory of pharmacology, general pharmacology. There are some drugs, chemicals which are not toxic to the body, but when metabolized by the liver, they become toxic. As an example, like carbon tetrachloride. They are not toxic, but when it enters into the liver, they are converted into toxic substance. So that is also one type of complications which you should remember. The study of first pass effect, study of conversion, what is the metabolic pathways, what is the compound making, the adverse effect. These all studies are very much important, even in the clinical and non-clinical study, before entering into a new drug to the market. Orally administered drugs cannot be proteins because the digestive enzyme of the drug break the protein into unless into useless amino acid. That's why insulin cannot be given by oral. It's only by means of parenteral route. And it's because it's a proteinous nature. The drugs must also be able to withstand the acidic condition of stomach. A special type of oral administration is sublingually. This is where the drug is placed under the tongue, where the vein enter the systemic circulation. Sublingual tablets. When it is a sublingual tablet, just now I told, because the advantage, rapid, emergency, no first pass metabolism, directly into the bloodstream, no GIT destruction, no food drug interaction. So dosage form friable tablet. So what is the disadvantage? Sometimes irritant drugs frequent use is not possible for this purpose. Rectal suppositories and there is lower rectum also available. Just now we have seen the picture and how to apply. Lubricate the end of the water soluble lubricant, wear a gloves and finger cord, what we have seen in the picture again I have explained. Insert into the rectum and length of the finger by pressing, and place the suppository next to the mucosal wall if the client prefers, and it able to provide supply self-administration also. Advantage, useful in unconscious vomiting patients, no liver, no first pass effect in advantage, inconvenient, irregular, incomplete absorption can be avoided, and even you can see irritation, sometimes irritation to the rectal mucosa, you should be avoid these type of drugs. As a disadvantage. Vaginal pessaries, we have seen the pessaries picture, and appliance insert into the vagina, usually as an aid towards maintaining normal position of uterus and the bladder. And gloves, an applicator is also nowadays available, because vaginal tablets for various infectious diseases and difficulties and also contraceptives they are using directly by themselves, it can be inserted with an applicator. If an applicator is used to wash thoroughly with soap and water after each use. If the client prefers and is able, provide supplies for self-administration. It's possible. You can see the pessaries, how it has been kept in the cavity of vagina, and it is near to the cervix area, and the uterus and the bladder, how the position is there. Sometimes there is sponge type, ring type, and pellets types also. You can see the applicator, how the patient is administering. Figure 1 is keeping the applicator, and there will be a pressing which can be pressed, and directly it will be inserted into the figure 4C, which shows that the pellets of the tablets or the inserts of the pessaries can be kept in the vagina very easily by the patient itself. Rectal administration, what is the advantage? Suitable for vomiting in children, unconscious patient, irritant, bad taste drugs, and first pass metabolism 50% can be avoided, and suppositories or enema dosage forms are available, and irregular absorption sometimes. Bioavailability cannot be very much determined how much, and irritant to the rectal mucosa is there. So there is a repetition for just to show. Now we are coming to the parenteral administration, in which intradermal in skin, subcutaneous injection, intramuscular, intravenous, intra-arterial in arteries, and intrathecal to the CSF and there is cerebral spinal fluid directly by spines, and intraperitoneal, the cavity between the abdominal region, and intra-arterial synovial fluid. These all are some of the parenteral routes. You can see here the picture which shows that intradermal, and you can see the needle number also, it is 23 size for a dermal injection, and you can see intravenous directly into the vein, 21 number the thin can be used, and 21 number can be used even for the vein. You can see the intravenous two places. Sometimes the veins are in the top, sometimes the deep veins can also be selected. And muscular, deep, and 20 numbers have to be inserted. You can see the structure of the picture: epidermis, dermis, subcutaneous, and you can see the muscular vein, how deep it was. So this is the way how the injections are made for the parenteral route. Parenteral administration, what is the advantage? High bioavailability, 100% bioavailability, rapid action, emergency, no first pass effect metabolism, because it doesn't enter into the GIT, and suitable for vomiting, unconscious patient. Irritant and bad taste drugs can also be given in parenteral route. No gastric irritation, no food drug interaction, while an ambule doses are possible to available. An disadvantage: infections, sterilization is very much must, pain, need, skill, and anaphylactic shock and expansive. These all things are a disadvantage. And the parenteral route, we are discussing just a picture I have given. Now we are going to theoretically small discussion about parenteral routes. Special consideration: preparation must be sterile and free from pyrogens. Pyrogen free, they are dangerous, which increases the body temperature. And their site must be clean and disinfected with alcohol or iodine preparations. And subcutaneous route, located ringer-acted calcium, boroglucate, etc. Advantage by subcutaneous slow, even, and prolonged effect. Implantation of pellets, large volume, non-irritant solutions. Advantages: painful, sometimes irritation solution cannot be administered in subcutaneous route. And these are the routes subcutaneous can be taken in the thigh, hand, and in the arm part and back also. These are the sites which can be preferred for subcutaneous route for various injections. An intramuscular route, a deep in the muscle, and the most common procaine, penicillin G. Advantage: rapid absorption with water-based solution, slow and even absorption, and long duration of action with oil-based solutions. Suitable for suspension, suitable for patients that do not need restraint. Disadvantage: possibility of injection into bloodstream, and this is the place which you have to remember actually, the parts which they are giving intramuscular. We know that a point at the side of the arm, opposite to the axilla on the bottom, you see that the place where is mid deltoid area, and you can see the vesicles of brachial vesicles. So we should not inject below, and there we might have seen the place where we are using for the vaccine. Corona vaccines were given in the midpoint area. So this is necessary for the students to know about which place they are injecting the intramuscular. And dorsogluteal site, you see the dorsogluteal site is a very safer place, but you should know about what all the parts and physiological parts which is near to them. Posterior superior ilium spine is there, so you should not go down. And the gluteal medius and gluteal maximus area, and you can see the square which I have shown, that is superior gluteal artery which is present there. You should not give. Below that we have given an area where the gluteus medius area which can be preferred for you to go for injection, especially the maximus. And we should know that there is a sciatic nerve and greater torcenter of greater torcenter of the femur. The femur torcenter, there we should be very careful when you are injecting, because muscular is deeper. So that's why we should know that femur is there, our important strongest bone in our body. So that's a place which you have to remember. And also ventrogluteal area can also be preferred, where they shown the picture with the finger, a cross which is made, that is ventrogluteal area, a triangle area which can also be preferred, very safer area. Anterior superior Iliac spine is there, so we should be remember that one. And iliac chest down is also should be there, and posterior edge, so that we can calculate which is the area of ventrogluteal area. Is the triangle area which is given, shown for you. And there also you have shown that is greater trochlear of the femur bone is coming over there, the ball and socket area. And also you can see the another, that is the vastus lattice area can also be used near to the middle portion of the vastus lattice area, can also be preferred for intramuscular injection. So intravenous route, example, we know that epinephrine, thiopentol, sodium. Advantage, no absorption problem, immediate onset of action, 100% bioavailability. Exact dose enters into the blood, irritation solution should not be used, large volumes can be injected. And disadvantage, no recall. Once you give, it has to be very careful before deciding the dose which is given to the patient. Immediately onset of action, complete sterility is essential, must be incomplete solution, particulate pulmonary embolism may be there. So you should be very much careful. The intravenous injection also, I have just to show you where the vein, usually you might have seen the armpit area or in the arm or sometimes in this area, the dorsal area. So you can see the part which are the we are in, there is only the area which I have shown is, that is blue color area, which is the thing which you have to, that is cephalous vein. In the armpit, that is axillary cephalic vein can be preferred, and middle cubical vein, that area can be preferred. Apart from that, it is possible sometimes for a old age or a young children can also be preferred dorsal vein arc, that is cephalous vein comes to the superior vein on the dorsal accept of the hand, can also be preferable for this purpose. Superior veins of the armpit, forearm will be used for the vein for the IV injections which I have shown in the picture. Veins of the hands and the forearm that may be used to administer intravenous fluid and medication as shown in the picture. And this is intrathecal, intraspinal route. Usually you may be knowing that it is nowadays intrathecal, that is intraspinal. Injections can be given, especially even for sometimes for cesarean can be done previously, but now they have found there is some back pain, so they go for general anesthesia. Spinal anesthetic, it may be called as sometimes it can be given as a regional anesthetic also. Antibiotics can be injected directly into the blood cavities, directly into the CSF. Advantage, ensures the drug enters into the CNS. Disadvantage, difficult technique, needs skill and needs specialized anesthesian for this purpose. And also vertebrate, you can see the picture, spinal cord, the spinal cord spines, when you are directly, they are injecting to the spine nerve, where it enters into the spine solution and it can be even controlled. There are parts which can be even decided for regional specific local anesthetics. Regional anesthetic is also possible. Topical application, produce local effect, skin, percutaneous, example allergy testing, topical, local anesthesia, mucous membrane of respiratory tract inhalation by asthma patient, inhalers, eye drops for conjunctivitis directly to the site of action, ear drops for otitis etrina, that is also for directly site of action. Intranasal decongestion, nasal sprays, when there is a severe cold and severe block in your nose, you can use decongestants directly, nasal sprays are available. And inhalation, example, what is the advantage of inhalation? Directly to the mucous membrane respiratory system, rapid absorption, large surface area, provide local action, minor systemic effect, low bioavailability, less side effect, no first pass effect, dose can be reduced, usually given in aerosols and nebulizer. Only few drugs can be used in this case. So you can see the inhalation route, absorption via tracheobronchial epithelium, gaseous and volatile drugs, inhalation, anesthesia, antibiotics, bronchodilators, etc. can be given. Advantage, very fast absorption. Side of action, upper respiratory tract infections. Disadvantage, poor regulation of the dose. Sometimes it is inconvenient also. And this is an example which you are smoking. Citrate of nicotine for migraine, for example, ergotamine tartrate can be given. For asthmatic patient, bronchodilator, example, you can see the inhaler which is available in the market. Albuterol, anti-inflammatory steroids can be added, so they have added beta-methasone, anti-allergic like chromyl sodium and ribavirin. Antiviral drugs are also available in this same inhaler. And nebulizer is always available in the clinics. And atomizer, sprayers, which is used, the boy which is sitting by means of using is the nebulizer. Battery, it can be used for a power to pump which can circulate. The nebulizer can uniformly, the dose can be given for breathing and directly action to in the lungs and bronchus. Transdermal patches, how it is transdermal patches, which are novel drug delivery system nowadays, advanced system, which can be scraped in the skin and pasted as shown in the picture in the arm. It can be kept very easy, and so that it will be easily inserted into the bloodstream through the skin. A medicated adhesive patch is applied to the skin. Slow effect, prolonged drug action, control system blood levels, produce systemic effect. Example, nicotine patches are available. Fentanyl and is a narcotic analgesic, and even nitroglycerin and vasodilator in a chronic congestive heart failures, and also even angina pectoris can also be given by this transdermal. When a drug are administered, they can be either local or systemic effect. This is what we are discussing now. What it means local, directly to the site of action. If there is a site of action if you have a bronchial constriction, directly giving a spray in the site of action directly. Or if it is an eye drops which is having eye infection, directly to the eye. If you are having an ear infection, otitis, then directly giving to the ear. If you are giving an infection which is directly in the injury, directly you are giving, that is called site of action, directly. Systemic effect means you are giving the drug in the whatever this through, maybe rectum or vagina or injection or oral route, it is entering absorption and it entering the systemic cycle, and then it reaches to the site of action. That is called systemic effect. So whether the drug is systemic effect or direct effect, very simple. For an example which we are normally using drugs, if I say, then the student can easily understand. For example, if you have an allergy, if you have an irritation in your stomach, you are using aluminum hydroxide gel or gelusil which you are drinking, it is direct action to the site of the stomach, neutralizing area. But at the same time, if you are taking omeprazole or lansoprazole, drugs which you are taking, it has to enter into the systemic cycle, and then it has to go for acting on the H1 receptor, H2 receptor, agonist, antagonist, or antagonist, and then agonist, the H2 receptor, antagonist, and so that it will reduce the secretion of the HCl. That is systemic effect. Okay, the local effect is one which acts near to the site of administration. The systemic effect occurs when the drug gets into the systemic circulation in distribution throughout the whole body. Very simple to understand. And the local administration, the main advantage of local administration is that it minimizes the system side effect because the drug does not enter to the systemic circulation. So advantage is there. The drug only acts where we want it to act and not at any other less desirable places. So it doesn't go to the other places. Sometimes it can reduce even adverse effects also. Example for some common site of local administration are skin, rubbing ointment, corticosteroids increases the inflammation, to decrease the inflammation, not increase, to decrease the inflammation, antihistamine to prevent the allergy reactions directly in the skin, and decongestants directly as a spray in the nose. Vagina, if there is an antifungal drugs directly tablets or creams which is applied in the vagina. Rectum, vasodilator to reduce the hemorrhoids, and if suppose piles and if there is a fissures in the area of rectum, directly applying. Lungs, bronchodilators directly spraying to salbutamol or beta agonist. If this drug enters into the systemic circulation, which sometimes happens, then maybe sometimes, but some side effect, they can even produce some side effect in palpitation may increase, example by means of salbutamol overdosage when it enters into the systemic circle. And atropine, there is homatropine which causes dilation to the pupil during the eye inspection and the surgery. So you can see systemic administration. What is systemic administration? It is used if we want to drug act on heart to reach the place such as heart or brain. We cannot inject directly. We cannot administer the drug locally to these places, heart or brain, which would be good, would be too transmit. So example, sticking to the needle in the heart or the chest. Site of systemic administrations are, even skin also systemic, it enters into the blood, you can see, like transdermal patches, they enters into the system. Glyceryl nitrate, which is applied at patches in the skin, allows the drug to diffuse in the skin and enters into the bloodstream. An advantage of sort of administration is that avoid the first pass effect by not having a pass through the gut. Nose, even nose also bypasses the gut, because the vein and nasal mucosa drain the vena cava. Example, cocaine, which has to enter into the central nervous system for its action, not in the nose. So even the root of sight, skin, nose can also be used for systemic administration. Clearly understand what is the difference between systemic administration and local administration. The root may be similar, but the drug, what is a drug physicochemical property? That is what the point which you have to remember. Vaginal and rectum, the blood vessels in the mucosal lining drain into the systemic circulation, thus bypassing the gut. Lungs, you see, ideal for gases. The large surface area in the mucus, high vascularity of the drug makes it ideal for absorption of drug. General anesthetic like halothane. Orally, parenterally, we are not explaining because we know that they have to undergo the circulatory system. Otherwise, there is no action. So, not that these sites of identical, the one which is local administration except the last two. It is physicochemical property of the drug. It is very much important. What is the physicochemical property of the drug? What is its pharmacological action, physicochemical property, which determines whether it will be stay in the site or it will go to locally or it will be absorbed into the systemic cycle. So that is a very important. I have made it in underline. It depends upon the physicochemical property of the drug. Decides when you are applying to the nose or vagina or rectum or to the mouth or sublingual, wherever you are applying, whether it is local application or it is systemic, determined by the physicochemical property of the drug which you are using. And other more exotoxic form of the administration, this is also an important thing which is nowadays emerging and also which is available in the market and which is more interesting formulation. For example, how get protein into the CNS, because very important. It should be lipid soluble, otherwise brain barrier cannot be passed through the drugs, because the blood brain barrier, only lipid soluble drugs are able to pass through the brain and exert the effect in the brain, where a solution have to be proposed, pumps. So implant cells which produce the protein to release into the surroundings. So viruses which work in the same principle. You just read, I have bolded. Implanted cells which produces the protein. Implanted cells which produces the protein and releases into the surroundings. Viruses which work in the same principle, making the protein and release it. Polymer and encapsulated. Polymer encapsulated genetically modified cells, which can be also nowadays very common formulation. Polymer encapsulated genetic modified cell. What I mean by that? This is a new and experimental method. Has been tried to administer neurotropic factors in CSF, cerebral spinal fluid, which prevents cell death. A polymer capsule is filled with the genetically modified cells. This capsule allows nutrients with CSF to pass into the cell, thus sustaining the cell inside, and also allows the neurotropic factors produced by the cell out to the surroundings. The capsule is implanted into the intrathecal space in the spinal canal and has advantage to being able to provide continuous administration of the drug. Another benefit is that the polymer capsule prevents an immune response against the foreign cells, thus reducing the side effect. No allergic reactions can be identified for intense. And next class we will see the pharmacokinetics of the drug, because it's a long things. Today only we have seen about some routes of administration, some definition, and the basic pharmacology. So basically what I want to say today is, you have to remember about what do you mean by systemic administration or systemic action, and what is the systemic action of a drug or a formula when you are taken, or what do you mean by the local action or local action or local administration. So local administration, systemic administration, what is the relationship, various formulation, how it is acting the pharmacological action. Just think about, just have an idea. Thank you. We'll see again.